Hi, I'm Dr. Mark Poray, a family and sports chiropractor in North Whitby, Ontario. In this weblog, I'm going to talk about cervicogenic headaches and how they are affected by what is known as the upper cross syndrome. If you viewed another weblog in this series, you'll recall that there are three kinds of headaches essentially. These are the tension headache, the migraine headache, and the cervicogenic headache. The cervicogenic headache and the migraine headache are very similar in how they present. They both cause nausea, vomiting, and visual problems. The difference is that the migraine headache is vascular in origin. The nerves in the arterial walls inside the head react to a trigger which differs from person to person. This reaction causes the arterial walls to constrict and then expand, leading to the symptoms associated with migraines. The cervicogenic headache originates in the muscles and joints of the neck and is not vascular. Another way to differentiate them is that migraine headaches are typically unilateral, always on the same side, while the cervicogenic headaches are also one-sided, but they may alter from one side or from one headache to another, from one side to another. The upper cross syndrome was first described by Dr. Vladimir Janda. In this syndrome, there were several weak muscles that included the serratus anterior at the front of the chest, the lower and middle trapezius muscles in the upper back, and the deep flexor muscles in the neck. It also presented with a group of shortened or hypertense muscles, including the upper pectoral muscles in the chest, the upper trapezius muscles and the levator scapula in the upper back, the suboccipitals in the upper neck, and the sternocleidomastoid at the front of the neck. The reason it was called upper cross syndrome was that when these points were connected, they created a form of a cross in the upper back. The result of this cross of weak and hyperactive muscles causes an overstress in the area just under the skull, the C4 and C5 vertebra in the neck, and the T4 vertebra in the upper back. We can see this presentation as bad posture, rounded shoulders, pelvis forward, and head forward, the classic desk worker's posture. Now, Dr. Kim Christensen proposed that sustained misalignments like this lead to permanent changes. In other words, just like an athlete who trains their muscles to perform in a certain way, people who permit the upper cross posture over a long period of time train themselves to have bad posture. So instead of causing this cervical stress leading to a cervical headache only once, they place themselves at risk of having recurring cervical headaches. Now, research has shown that medication can have a 49% positive effect on headaches, and that chiropractic manipulation has about a 40% positive effect. The extended effect was that meds showed about 24% continued positive results, while chiropractic manipulation was 42% effective, and the combined group was only 25%. These results seem to indicate that medication and chiropractic adjustments are quite similar in the short term, that chiropractic has better long-term results, and that combining the two seems not to be particularly effective. The difference further supports chiropractic manipulation for its lack of side effect compared to medications. Now, there are several exercises which can be incorporated into your daily life to help improve your posture or improve the posture that leads to upper cross syndrome, winding up in these recurring cervicogenic headaches. First is the pec stretch. Face into a corner with your arms at 90 degrees, one against each wall, and then stretch forward and hold that for 30 to 40 seconds, breathing slowly. The second is to place both hands behind your head, tuck your chin in, and push back with your head while resisting with your arms for the count of 6. And you can repeat that about 3 times. The third exercise, which is quite helpful, is to lie on your back on a Swiss ball or a physio ball if you prefer, and extend your arms over your head and rock back and forth on that ball to help improve your posture. In general, it seems that a combination of chiropractic adjustments, interferential therapy, trigger point massage, exercise, and an alteration of your daily activities presents the most effective way to avoid recurrent cervicogenic headaches from this upper cross syndrome. I hope this has been helpful to you. For more weblogs on other issues, please see my website at www.drporay.com or make an appointment with me at the Brooklyn Family Health Center on Highway 12 between Whitby and Brooklyn by calling 905-655-5767. Thanks again for watching.